Yeah, my name is Ryan. I'm a consultant psychiatrist and editor of Global Psychiatry Archives. And I'd like to report or discuss a paper from Younis, Tuma, Kunda, and Arafat, who worked in Baghdad with the support of Yasir Arafat, who is in Bangladesh. And it's about the prevalence and associated factors related to burnout among doctors in hospitals in Iraq. So burnout is usually quite common among mental health or health professionals and doctors, and it's about having negative attitudes towards a job, leading to distress, work dysfunction, and low accomplishment. Usually, there is three parameters on burnout, which is the feeling of emotional exhaustion, the increase of mental distance from one's job, which we call depersonalization, and feeling of reduced professional efficacy and low accomplishment. So usually it's measured with a scale developed by Maslow. So it's called the Maslow Burnout Inventory, and it has these three factors. And usually it's different numbers of questions. So it's about, it's altogether 22 items, and there are different subscores. I come to the subscores later, and this study has been done in Iraq. And I just then would like to go to the demographic samples. So the team had developed a demographic characteristic questionnaire, and so it was quite young doctors, different age groups, different gender, marital status. They measured number of children, job title. There were residents and consultants, work experience, number of working hours per week, number of shifts per month, number of holidays, or duration of holidays, additional private practice, and so in total there were 303 people. And what you can see here in this figure is that the emotional exhaustion was high in 33%, low personal accomplishment in 15%, and depersonalization in 26%. So lots of people were in the middle range, but there's lots of people also which had quite a bit of burnout in total. So what are the factors which are related? And these authors looked at the subscales, which make sense. So age affects the burnout. So younger doctors have higher burnout. Females have slightly, but not significantly, higher emotional exhaustion. Marital status is, if they're single or divorced, they have higher emotional exhaustion. So it seems that married people have a little bit more of stability, and having no children, possibly related to the family status, again is negative for emotional exhaustion. It seems that residents have significantly higher exhaustion than consultants. The work experience, so lower work experience, leads to higher emotional exhaustion and longer working hours, again, higher exhaustion, more night shift, higher exhaustion, less leave, again, significantly higher exhaustion. And it seems that people who are in private practice, possibly more experienced, they have less exhaustion. Right, so more or less the same picture in the reverse, because professional accomplishment, the scale measures low personal accomplishment, and again, more or less the same factors affect this. And I won't go in this detail, but I refer you to the paper. Interestingly, again, females and males have no big difference in this professional accomplishment or low professional accomplishment. as it's scored in this Maslow scale. Right, other factors are significant, many of them, and same applies more or less for depolarization. And in summary, what you can say is that there are quite a lot of burnout in people, and some of the factors are quite understandable, like more work experience leads to a bit more stability, less working hours are better, number of night shifts can lead to emotional exhaustion and depolarization, and if you have no leave, then it's quite bad. And again, having a private practice, possibly being more experienced, reduces the burnout. So in total, what this story tells you, and come back to the conclusions, doctors working and living in Iraq have quite a bit of burnout syndromes in different areas, and the different areas are quite consistent with the correlation with specific characteristics of their work. So this means that, at the end of the day, there needs to be care to look at these factors to make sure that people don't completely burn out. And it's my understanding that there are similar results in other countries, which again should be looked at carefully. This is a very interesting and enlightening paper and carefully written, and I hope you can enjoy it looking at our website, www.globalpsychiatry.co.uk. And if you like this type of information in a video, please subscribe to our channel. And maybe I can also mention that Maha Younis is a professor in Iraq and has published a report in our journal about her experience in being a psychiatrist, or especially being a female psychiatrist, in Iraq during times of war, crisis, and more stable times. Thanks for your interest, and thanks for listening. Goodbye.